so good to see you today. We're gonna do
hold on.
GI assessment. It's on. It's on.
You don't
Stop.
like it.
It's on. It's on. Okay. All right. You can lay down.
Have lay down.
Bladder's empty.
Yes,
You're
ma'am.
gonna have a pillow under your head and arms at your side.
I just emptied my bladder.
Okay. And we have some what do we have going on? We have some heartburn?
Just some heartburn, yes,
Okay.
ma'am.
All right. So welcome back. I know, listen, I feel like I appreciate your help with this. All right, so the first thing I'm going to do is I'm going to inspect your abdomen, okay? So I'm just looking at your abdomen, and when I do that, I'm just looking for any abnormalities, okay?
Okay.
Is it distended? Is it flat? Is it rounded? I'm looking for scars or any visible lesions or rashes or masses or anything that I can see from the outside. It looks like everything looks pretty good. So, and we can see, this is important that we are able to see. All right, so before we get started, let me go ahead and do some hand hygiene. Let's get this done before we have to start over. All right, so we got some hand hygiene there, and so we've done some inspection, and the next thing we're going to do is we're going to auscultate. So we're going to just start by listening to your abdomen. I'll start, and I'll listen to all 4 quadrants, and I'll listen for any extra sounds with the blood vessels as well, okay?
Okay.
All right, good. All right, so we'll start over in your right lower quadrant. We'll move up to your upper quadrant, then to your left upper quadrant, and then to your left lower quadrant, okay?
Okay.
And I'll just listen for a few minutes, and we're just listening for, make sure you have some vowel sounds in there, okay? Okay. Thank you. You got some good vowel sounds. All right, so next I'm going to listen to your abdominal, next I'm going to listen to your abdominal aorta, okay?
Okay.
We're going to listen with the bell, okay? We're listening for brutes. No brutes there, okay. You're a rib. These are your renal arteries. Your iliac arteries, which are at your hips. And then your femoral artery. No brutes heard there. So everything sounded good, okay? Let's see. Now we're going to move on to the percussion of your abdomen, okay? So we're going to do each quadrant just as we did before when we were listening. And if you Feel any pain, just let me know and I'll stop, okay? All right,
Very
so this is called percussion, and we're just gonna start here. I'm just gonna tap, and I'm listening for the sounds here, like the dullness or the timpani. All right, everything sounds normal. So I just moved my hand around, with struck on in the middle finger just to hear if I heard any timpani, or everything sounded good though. So it was consistent and rhythmic. All right, now I'm gonna try to measure your liver by percussing. Okay. So what I'm gonna do is I'm gonna start here in the midline below your breast, and I'm just gonna start percussing until I hear some dullness. All right, I'm just gonna mark it. All right. Then we're just gonna move up to find the edge of your liver, okay?
Mm-hmm.
So that's pretty normal. So about 8 centimeters. Everything sounded good. All right. What I did was I just started tapping right below your nipple, went down to the middle of your chest until I heard the sound become dull, and that was the top of your liver. Okay. Able to see. Then I just moved up the opposite way from the bottom lower quadrant up until I found the edge of your liver. It's about 8 centimeters, which is a normal range. All right. The next thing I'm going to do is I'm going to percuss your spleen. Okay. So your spleen is on this side. All right. And it's kind of tucked up under your rib. Your ribs are kind of different than mine. So, all right. So what I'm going to do is I'm going to start percussing to see if your spleen's enlarged. All right. You ready?
Mm-hmm.
Okay, no dullness beyond the costal margin, which means your spleen is not enlarged, which is good. So it's kind of tucked up under, so your spleen is here, it's kind of tucked up under this rib cage kind of sort of thing.
Mm-hmm.
But anyway, it sounded good. I didn't see any problems with that. So the next thing I'm going to do is I'm just going to deeply palpate your all 4 quadrants again, just to see if I feel any masses or any tenderness or anything like that, okay? All right, you ready?
Mm-hmm.
Any pain?
Mm-hmm.
Have you been to the bathroom today?
Mm-hmm.
You have? Is it sore there?
Mm-hmm.
You feel a little extra firmness up there at the top. No pain though? Okay. go around one more time. Okay. I didn't feel any abnormal. It just feels a little firm here at the top, but you know, it could be stool, it could be anything in there. Could be that you just ate, right?
Yeah.
All right, so no tenderness, and I did palpate pretty deeply, so, and you didn't have any tenderness, so I'm thinking everything is fine. I didn't feel any masses, and on my deep palpations, you didn't have any tenderness, so that's good. All right, so the next thing I'm going to do is I'm going to check for CVA tenderness, which is to check for kidney issues. So I'll gently tap on your back just below your rib. So you're just going to have to turn to your side. Okay? And here's your ribs.
Mm-hmm.
I'm just going to... Any tenderness?
Mm-hmm.
Let's see. Your rib cage is low, which is not a problem. It's just different than mine. Which is okay, because you're different than me. Okay, no tenderness. Alright, so if you will, so you roll to your side and you didn't have any tenderness. Oh, bless you.
Thank you.
Alright, you ready for this one? Okay. Still no tenderness? Okay, good. All right. So you said no pain when I do that. All right. So getting almost to the end. So we're going to check now for rebound tenderness, which you'll have to lay back on your stomach or on your back. I'm sorry. And I'm just gonna press in really kind of deeply, and then I'm just gonna take my hands off real quickly to see if there's any tenderness there. Okay. Any pain? Okay. Let's see up there. No? Rebound tenderness? Okay, good. Alright, good. So, no rebound tenderness, which is great. No CVA pain, everything looks good. The last thing I'm going to do is I'm going to palpate your aortic pulsation. So we're almost done. I'm just going to feel here, okay? Breathe normal. Okay. It's good strength. Probably about two. Good. Sound feels good. Nothing wrong there, I don't think. This is the main artery in your belly. Alright, so I don't really see anything that that could be really causing your heartburn. It's probably just maybe eating too late at night, maybe laying down right after you eat supper or something. Yeah. So I'm just going to give you some suggestions for some diet suggestions. Maybe avoid spicy foods. Limit your alcohol consumption, things like that. I have a whole lot of little helpful tips for the GERD. Do you take Maalox? You said you took Tums sometimes. Does that help some?
Yes. it
Okay.
helps.
All right. Well, we'll continue trying to do some simple things to begin with before we go to medicine or anything more aggressive. So
Okay.
okay, so we'll just see you back in 2 to 4 weeks after I give you the information and we'll go from there. Okay.
Okay. Sounds great.
All right. Sounds good.